Hi, Deborah. Welcome. Just you so far, but this is
Hi.
hi. This is common. People usually just drop in for the next hour. It's pretty casual. Have you been here before?
No,
Oh,
no, I haven't.
welcome. Hi. I like your boardroom.
Thanks.
There's a couple more people. I'm just gonna let them in before we start. Hi, Amy. Hi, Amy.
Hello.
Hi, how are you?
I'm doing well. We're having great weather here, so
Oh, good.
it's a
Where's,
good start to February.
tell me again where you're from?
Um, I live in Southern California near Pasadena.
Amazing.
Yeah.
Okay, we can start chatting and I'll just let people in as we go. But Amy, you've been here before, right? No? Maybe? It's first time for Deborah. Let me get this chat open for everyone. Okay. Welcome to Ask Anything. I'm Shirley. I'm the founder of Menopause Chicks. I've been hosting these 1 hour, usually 1 hour sessions on Mondays for probably we're into our third year. Oh my gosh, I can't believe it. But anyway, it's a very casual um, conversation. It's a chance for you to have your camera on if you choose to or not, your microphone on if you choose to or not, or if you want to just pop something into the chat and you want me to talk about a specific question or topic or clarification. We can do all of those things. And usually it starts at about this tempo, and then sometimes just lots of people join, and it can take us in all sorts of directions. So I love it when it's small, but I never worry about it if there's only a couple people showing up. Unless you're here to just listen, and then it might be kind of quiet, and then I might have to like give a TED talk on something, but I doubt that that's going to happen. So, Amy, I'm thinking you've been here before. I see Josie's
Mhm.
joining. She's been around since probably the beginning of Ask Anythings. And Deborah, it's your first time, right? And what brought you here today, Deborah?
Oh, well, I'm a subscriber to your newsletter, so I just haven't made it before. I just
Okay,
really wanted to come. So I'm curious
amazing.
to know what the live version of you is all about.
Well, it started out with The Nest, which is a like a off social media community, which we're currently revamping and going to relaunch it with a new book that I have coming out this year. So that's still a couple of months away. And then I opened it up to everyone who has watched the master class because often what I've found, at least with adult education and with health education, is that once we get curious about something and we start, oh yeah, okay, I did learn that, it makes sense. It usually turns into more questions. It's like now I want to know if X means Y or what this piece of research might mean for me. We often have people who join who are advocating for others too, right? So they might be in a role at home, at work, or in their community where people are bringing up the conversations about perimenopause, menopause, and postmenopause, and they don't yet feel confident to know what to say or how to direct their friends. So we do all of that.
Great, thank you.
Did you have a specific question?
I guess I wanted to ask you if you have had some questions in the past about surgical menopause,
Hmm.
because that to me is the biggest questions I have because that's what my situation is.
Okay.
And, I just find that it's not talked about as much.
So you've had
So
your ovaries removed?
yeah, I've had a radical hysterectomy.
Okay.
Yes,
And how old are you?
61,
And how long since your surgery?
6 years.
Okay. And so have you been getting the support that you need um, in postmenopause? Are you surrounded by a strong health team? Are you exploring hormone therapy?
Yeah, I'm lucky enough to live in downtown Toronto, so I have a menopause doctor
Okay.
at Mount Sinai Hospital.
Okay.
They have a really good women's health initiative that they call Mature Women's Health
Yes.
Program. So I've been there probably about 4 years now.
Okay.
And prior to that, I was at St. Mike's Hospital. So I had a very good team. But the thing was, at the very beginning, the surgeon said, "Oh, I'm your surgeon, but I'm not your menopause specialist," right? So
Yep.
I know nothing about hormone therapy. I know very little. Go see a gynecologist, go see someone who's my colleague over here. So that's how I met the menopause specialist who
Okay.
also happens to also be a gynecologist and a surgeon. So that was great that she had all of those things. But I since learned that she had, as she described to me, 15 minutes of menopause training, and the rest of it was really her own interest in becoming a menopause specialist. And then she moved from this one hospital, St. Mike's Hospital, to Mount Sinai because they were willing to have the funding there for Mature Women's Health. And you may know Dr. Wendy Wolfman,
I
who
do.
is one of the great voices on menopause health. She is at Mount Sinai and the lead on this, but she's in her 70s. So
Yes.
my menopause doctor is going to be taking over. She's in her 30s. So
Yes.
she's a really wonderful doctor. But however, interesting though, because I'm 61 and my doctor's in her late 30s, she doesn't really relate to the stories I tell her. You know what I mean? Like when I first started to talk to her about feeling tired, lack of energy, right? She said to me, "Well, if I was your age, I'd probably be feeling that way too." That's not exactly what you want to hear at the beginning of a
Oh,
conversation,
no.
right?
Right?
Like, are you slowing down or tired? Like, those kind of questions. And I was just like, no, I was launched into menopause at the age of 54 and was not ready and was working full time and had a teenager in the house and, all of those things. And I wasn't feeling like, oh, it was time to slow down because I had surgery. So we kind of got over that hump at the beginning, where I sort of said what I was doing. And really, she learned from me and I learned from her. So I've played around with different kinds of HRT because I have no ovaries. I can't have progesterone, but I have estrogen, right?
Not true. You can have progesterone.
See, this is
We
really
can talk
interesting.
about that if you want. We can talk about the nuances of that statement if you like, but I'm sorry for
Yeah.
interrupting
So
you.
like well, I'll tell you what she told me, like, and you can
Oh,
maybe tell me more, but she said, you could have so I've gone from pill to patch to gel, right? So now I'm
okay.
on the gel.
Okay.
And so, because I'm over 60, she wanted me to take slightly less and see how that goes. And I'm okay with it. But, I keep hearing the benefits of progesterone over and over online. And she said to me, and this is sort of a quote, "If you don't have ovaries, you can't process progesterone. It doesn't do anything at all." So I've asked her, because of course I was told you I was feeling tired, among other things, right?
Right.
And I thought that might be the helpful thing. So she gave me Androgel, which is a testosterone
Right.
gel formulated for men,
Yep.
in North America. And that works like a battery pack. I really like it. But there are some side effects I'm not too crazy about. Like sometimes I say I'm a bitch on wheels when I get it. So, when I'm walking around dealing with some stress, it kind of exhibits as being a little bit that's the best word, bitchy or a bit, short.
Okay.
Yeah. So because what it does is it kind of speeds up my metabolism, I find, so sometimes it's great if you want to put it on and go for a walk. Other times it's not so great. Right. So anyway, having just said what I said, what do you know about progesterone and surgical menopause?
Okay. Well, so first of all, hi Gail, welcome. Gail is just a couple of weeks or a few weeks from her surgery, same as you, Deborah. So thanks for bringing up this topic. Um, it's very, very common for surgeons and even oncologists to say what your surgeon said to you. So I'll begin with that because I want you to know that you are not alone. And it's a huge plug for all of us to, if we haven't already, to kind of pivot our thinking to we need a health team. Regardless of which journey you're on or how old you are, or where you are, you need a health team, usually. Even though I am pro like working with your primary care provider first, if that's the shortest distance between 2 points, I spend all day, every day helping women prepare for that appointment so that they can do that. But in situations like both of yours, Gail and Deborah, that's very common. Secondly, it is commonly misunderstood that someone without a uterus does not need progesterone. This is a gross misinterpretation. So I'll say two things. One is, if you've watched the Menopause Chicks Masterclass, you know that progesterone is just as important as estrogen. Estrogen is produced in the first half of our cycle when cycles are regular, and progesterone is produced in the second half of our cycle when cycles are regular. And progesterone has hundreds of roles and responsibilities, including investing in our brains, investing in our bones. Most commonly, it's referred to as the hormone responsible for supporting sleep, supporting our mood, regulating bleeding, and taking care of the lining of the uterus, which is where this misinterpretation has resonated for years. So, when we are postmenopause or when we are taking menopause hormone therapy, we cannot take estrogen. I have a uterus. I cannot take estrogen unopposed. If I have too much estrogen over time, the uterine lining will thicken and that could turn into cancer. So for someone with a uterus, you must take both. That doesn't mean that someone without a uterus wouldn't benefit from the potential benefits of progesterone therapy. That's because you don't have a uterus anymore, but you still might be looking for that support for your brain, your bones. I mean, that's kind of a nuance. We have estrogen and progesterone receptors in every part of our body, but most women come to me and say, I really want to experiment or try progesterone because I feel it might support my mood and support my sleep. And besides, I don't have ovaries anymore, so I'm not making progesterone. And I'm 61 and I got 40 more years in the tank. And so I just want to see if it's going to be of benefit for you. I don't think that it is a physician's decision to decide. I think it's the individual's decision. And so as a women's health advocate, I say you are in the driver's seat of your own health. And as an advocate, the other thing that I often do, Deborah, is craft some script tips that might help bridge that conversation. So you're talking to someone who is definitely trained that if you don't have a uterus, you don't need progesterone. And you might, I'm going to let you see if you have any, if you want to interject here at any time, but what you might want to try in that conversation is something like, I just have this strong intuition. I know that you're the doctor, but I have a strong intuition that I could benefit from progesterone. And I know other women in the Menopause Chicks community who have had a hysterectomy and they are taking progesterone. So, what about this? Will you write me a prescription for 3 months? I'll come back here in 60 to 90 days. I'll keep really good notes and we'll discuss how I'm feeling after 60 days. And then we can use that to decide what's best for me. But you might also be able to use this for other women in your patient panel. How does that sound? And then they're likely going to say, okay.
That's really interesting. I had a similar conversation with her, and she said it was a placebo if I was to use it. She said it would be like taking sugar. It would do nothing because my ovaries cannot process progesterone, is how she described it to me.
Yeah, so that's a misinformed practitioner. So I would say, I've been investing in my own health education recently. I've watched this masterclass. I've learned the roles and responsibilities of estrogen and progesterone and testosterone when my cycles are regular. And quite frankly, progesterone has more than one role. It's not, it doesn't have one single purpose of protecting the uterus. It has many roles.
So, with a radical hysterectomy, do you know anybody who's tried this
Oh
and
yeah.
it's helped a lot? Because I have never met anybody. So that's another question I had.
Yeah. Yeah. So, I mean, I can't name names, but there's definitely folks in the Menopause Chicks community. I could do a search in the community in the upper right-hand bar. There's a little search tool, and we could find these conversations
Mm,
in the past. Um,
great,
and
good.
sometimes it's really finite. It's like, finally got progesterone and I slept through the night. And for other
Right.
people, it's nuanced. I can't quite pinpoint it, but I just know that I feel a little bit more like myself again.
Right. Okay. Well, great. All right. I'll have that conversation and report back.
And then, yeah, I think that that's I like to talk about the
Well,
shortest distance between 2 points. We know there's
yeah.
online prescribers and all other places where, you could entertain, but I just feel that it's best to work with the person who's in charge of overseeing your menopause hormone therapy.
I have a menopause doctor and I have a family doctor. So
Yeah.
perhaps I could go to my family doctor and have that conversation
Yes.
and see what she says.
Oh, so
Um,
this is the menopause doctor who's saying this. That's not the first time I've heard that from Mount Sinai. I hate to say it.
really? Yeah.
Yeah, I
Wow.
mean,
Okay.
I know a lot of the doctors there, but yeah, so some other script tips just for them would be I kn I know it's common to tell women who've had a hysterectomy that they don't need progesterone, but
Mhm.
I'm here. I'm just inviting you to work with me. Can we go outside the box a little bit and try this? And I think that I mean, I would hope that you're going to get a positive reaction.
Yeah.
Yeah.
Okay. Well,
And
thank you
also,
for that.
you haven't mentioned it, so it's my responsibility to ask, are you using vaginal hormone therapy as well?
No, I don't feel that I need it actually.
Oh, yes, you do.
No, I hear that I do, but I feel like I don't feel that I need it because I have enough estrogen gel. But are you
Oh,
suggesting estrogen in my vagina as well?
yeah.
Or
So
identify?
when we take estrogen transdermally, it's called a systemic. So that benefits our systems, right? The brain,
Right.
the heart, the bones, the skin. But it doesn't treat the genitourinary part of our body. And so by using a vaginal estrogen or a vaginal DHEA, it does
Right.
three primary things, but
Mhm.
prevents or treats vulva and vaginal dryness.
Mhm.
It's approved by the Urological Association for the prevention of UTIs. And the UTIs are very common because after estrogen declines, the urethra gets shorter and smaller. It's my chance to use the vulva puppet today. The urethra is this little rosebud here. And when it shrinks in size, it's more susceptible to infection, so we can get more UTIs. This becomes a concern as we get older. So definitely want to do as much prevention as we can. And then the third part is it can support bladder health too. So, incontinence is a huge issue for a lot of women. And I just want you to have this information so that you're
Yeah,
not waiting for something to happen and then you have to back up to treat it. If we can prevent it
right.
at 61, that's the best case
Well,
scenario.
I do have the prescription,
Oh, okay.
but I haven't used
Okay.
it regularly. I tried it and then I felt okay that I didn't really need it. But you know what? I hadn't really thought about what you had said in terms of prevention as I
Yeah.
got older. Just because you don't need it now doesn't mean you're not going to really need it, right?
Yeah.
So I'll start using it again.
Hey,
Yeah, thanks.
amazing. Amazing. Anything else you want to keep me posted, or if you need any scripts for your next appointment, let me know.
Question. So
Yeah.
should I have the same conversation with my general practitioner doctor and see what she says?
Yeah, so you have a unique situation because you've had a oophorectomy and a hysterectomy. For most of the members of the community, I would say work with your GP, work with the doctor that you have for sure. I think it's your decision because you've built this health team around you. What or who you work with next.
Right. Okay, thanks.
You're welcome. Hi, Gail. Oh,
Hi.
hi. Nice to
Um,
see you again.
okay. Yeah, I'm 3 weeks. Ooh,
3 weeks. Okay.
yeah. I'm having a little achiness in my one side. I think now that things are kind of healing it, they're kind of hardening up in there. I don't know what's going on, but I'm kind of having a not the greatest day because I have that sore side, but
Uh,
I go next week. So next week is my doctor's appointments extraordinaire.
okay.
So I see the surgeon for my post-op and the pathology. And then I see the pelvic floor physiotherapist. And then I see my doctor.
Gold
So I'm all
stars.
lined up.
Gold stars for your to-do list.
Yes, so I have my list here.
Okay.
So the whole thing with vaginal estrogen is which is like I am so on board with because I do have vaginal dryness. So that's like a no brainer. I'm doing it for sure.
Okay.
My question is about the Imvexi and
Okay.
the Vagifem.
Okay.
Now, what I was reading online, and I mean, you had spoken about it as well, and other people have that it doesn't. The Vagifem doesn't, I guess, sometimes melt as much.
Yeah, I have to be careful because I don't want to
Or
be like spreading a rumor that that's true across the board. There was
right.
actually just one lot of
Oh,
Vagifem in the last year that got had a recall actually because
oh.
it wasn't melting properly. And then yeah,
Well, that can happen with anything. You're
it can
right.
happen with anything.
So the whole thing with that online, what I was reading was that okay, so if you know price was an issue, that Imvexi was more expensive and then Vagifem was less, it's more expensive.
Okay.
That doesn't really play here because I'm in Manitoba and it's covered, so
Yeah, and I
I
think it
shouldn't
depends
have.
on where you live and where, yeah.
Um, so the other thing I was going to ask you about, which is, I don't know, everybody's different. I'm not comfortable talking about my vagina, but whatever.
Okay.
Um,
I'll talk about your vagina then.
okay. After having 4 boys, um, I don't know if I'm bigger down. My vagina is bigger, wider, whatever. Anytime that I ever had a yeast infection, which I was prone to quite often a few years ago, and then I haven't had anything for years, but there was a time frame when I was having them a lot. Um, I was doing the oral thing, and then I was like, oh no, I need the cream. And then I tried the like I guess suppository is what they called the tablet, um, and it would fall out,
Mm,
even with the like insertion of with the applicator.
right. Okay.
So I would do it at night, just my last pee.
Yeah.
Then I would put it in, and then I would go lay down so that I was flat and
Yeah.
it wouldn't fall out.
And if you read the directions for Vagifem, it'll tell you to do the exact same thing.
Does it?
It'll tell you to apply it at night and to lay down after you apply it. I don't know. It kind of annoys me a little bit.
Mhm.
But you can, we can
Because
do
I guess Invexi, I guess, is smaller. They said it's
invec.
smaller and less messy, is what online where I read, and
Yeah.
that
And
um,
so I've heard that the film consistency, which would be like the mode of delivery for Imvexi, does melt upon body heat better. And in fact, women, they won't use the applicator. They'll insert it with their finger. They'll wait for it to kind of dissolve, which is not going to be instantly, but read a page in your book or whatever. And
right.
then they can use that. Why this happened to me last week. I couldn't think of the word that I'm trying to describe it by, but after it melts, they can
Right.
use the liquid to also rub it into the vulva as well, so that the skin
Okay.
cells on the inside and the outside are getting the advantage of Imvexi.
Okay.
So that might be, if I was you, that might be my number one choice. Although you could also go for Estrogyne, which is a cream.
Okay. I have that estrogen written down. I
Yeah.
thought that that was an external. It's not.
No, no. So it comes with an applicator as well. I would ditch
Okay.
the applicator and use your finger the same way you use the Feel Amazing moisturizer. Um,
Right.
what's different about Estrogyne, so Estrogyne is on this column, and Vagifem and Imvexi like are almost the same molecular structure.
Hmm.
It's a different estrogen.
Oh,
So this
okay.
is estriadol.
Right.
And this is estrone, which is
Um,
considered a weaker estrogen.
okay.
So you might respond to it just fine. You
When
might,
I'm already having issues, I kind of want to be like, get the bang for my buck.
I think that the best, well, I can't tell you what to do, but I can tell you what
No.
I would do.
Yeah.
I would get the prescription for Imvexi
Hmm.
and use it internally and externally. They're going to probably tell you to use it every day for 14 days and then 2 to 3 times a week after that. And I would
Hmm.
moisturize with Feel Amazing hyaluronic acid on either alternate times of day if you need it every day or on alternate days when you're not using the estrogen.
Okay. Yeah, I have your cream too. So,
And then when that prescription comes up for renewal, you get to decide again. You can be like, I don't want Imvexi. I want to try something else.
right. At least I
Okay.
started.
You can change your mind. Yeah.
That's right. um, yeah, and okay, so this week as well, or I see, I don't even know days anymore. It's Monday,
That's
right?
okay.
I think it was Thursday or Friday of last week that I signed up online for I think it was the Arthritis
Oh, yeah.
Society of Canada, and it was with menopause as well.
Yeah.
So you actually got a shout out,
I
Shirley.
know. I got lots of new members. Was that from because of you?
I don't know, but it was
Oh,
like,
did you
wow.
mention? Oh,
No,
because,
I didn't. No, the doctor did.
oh,
The
cool.
doctor mentioned
Because I want to circle
menopause
back and
chicks.
thank. Okay.
So it's Dr. Lega, I think,
Oh, Dr.
Lega.
Lega. Oh, so nice. Thank you.
Yeah. So I was just like, wow, woo, everybody's in the know here with the menopause chicks. So this is so good. Um, okay, so something that came up with her.
Yes.
Now she was lovely, and I really liked her.
Yeah.
So she posted I can't say the
Contra
word
contraindications.
indications, contraindications for taking HRT.
Okay.
So they do not treat like with blood tests and all those kinds of things. You start HRT because of symptoms, which is what you've always said. So I was like, yay. So my symptoms aren't vasomotor.
It's okay.
So I'm going to get slack from my doctor now because I want to start, but I don't have vasomotor.
Well, vasomotor symptoms is only one of the symptoms. You want to support your sleep, your mood, your bones. Please say bones first.
Yes.
Yeah.
Okay, so I'll really be clear on that then,
Yeah.
because that was my first initial thing. I'm like, wait a minute, that's what they kept talking about. Was that's the first reason they actually would prescribe?
No, it's the first one that's mentioned on the list, but it's not the first reason why they would prescribe. I think
Okay.
that's a bit of a misinterpretation because vasomotor symptoms are fleeting. They could
Hmm.
be here today, not tomorrow, depending on your age and stage. Whereas you're investing in bone health, or you're investing in menopause hormone therapy benefits because you want to invest in your overall health for the next 40 years.
Right. The other one was I've already mentioned to you before about the history of cardiovascular problems
Right.
in my family.
Yeah.
So one of her indications was heart attacks, personal heart attacks. So does that mean personally I've had one, or
Yes.
because it's a family history?
No, it means personally if you've had one, but
Oh,
I
okay.
find this, so I didn't attend the arthritis session. I find this piece of content concerning just because I'm an interpreter, um, because listing contraindications as a slide is
Hmm.
very misleading to an audience when menopause hormone therapy is a very individualized protocol.
Hmm.
Very individualized. My dad had a cardiovascular disease. That doesn't mean I can't take menopause hormone therapy. In fact, it means I should take menopause hormone therapy because, overall, I'm investing in my cardiovascular health when I keep my cholesterol in check, my blood pressure down. Um,
Hmm.
and so, yeah, I
Okay.
find I don't list contraindications in any of my presentations, but I
Hmm.
like to emphasize that this is always an opportunity to have a very personalized benefit versus any potential risk conversation with your doctor. And when I say risk,
Hmm.
I usually don't even say heart attack, although maybe I could. But really, what the evidence says from the Menopause Society is stroke.
Okay. So
So
they mentioned stroke as well. Yeah.
if you've had a stroke, then it doesn't mean you can't take menopause hormone therapy, but it means maybe they're just going to watch you a little bit differently. Maybe
Right.
it's going to be a slow increase in dosage if that's applicable. There's lots of ways to tailor this
Hmm.
protocol for you. And I get very upset when practitioners and people interpret things as black and white, like
Yeah.
no uterus, no progesterone. Oh,
Right.
sister's mother's, husband's grandfather's daughter had breast cancer. Does that mean I can't, and
Oh, yeah.
it's like, no, like it's
Hmm.
what is your personal risk. And
Right.
that's where you and your doctor are the two experts in the room having this conversation.
So I guess that's why they said blood clots as well, because that leads to stroke. So,
Yes, yes,
okay. The other thing,
yes,
talking about transdermal estrogen,
yes,
I kind of want to go that route only because my
yes.
last appointment with my doctor, which was September of last year, um, he said I had a fatty liver, which I never knew. That just kind of came out of nowhere. And he's just like, oh, by the way, he says, he goes, but 25% of the population has it and they don't know they have it.
Yes.
And I went, oh God, now what do I have to do to get rid of this? Okay, so no more McDonald's and drinking black. I actually started drinking black coffee. I weaned myself off cream because
I
that was one of the
love
big
black
major
coffee.
ones that supposedly is supposed to help you. I don't know. I'm doing it anyway, so I'm drinking black coffee now. So I don't know. I guess he can test that level, and kind of watch it. But I haven't had any, symptomatic issues with that or anything because obviously I didn't even know about it. So that transdermal estrogen makes sense to me because then it doesn't go through the liver.
That's correct. And it should be the first go-to that a prescriber would suggest.
And they say usually the patch first, or is it gel first?
No, patch and gel is more often a consumer choice. So a
Mm,
patch is applied once or twice a week. It is I find it, especially with the conversations in the Menopause Chicks community, it's very cumbersome for a lot of my members.
Hmm.
They put band-aids and tape, and if you swim, and it's just a pain in the butt. Whereas for me personally, it's easier for me, and this is literally mine, right? So this sits on my
Hmm.
desk. I come down here in the morning. I do it and I do this and I do it every single day and it's just part of my routine.
So
So
you're just putting it on the inside of your arm?
I do. Yeah.
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 Oh, okay.
Like I think I did it today. I'm not sure. So can you see my arm? So I pump it
Yeah.
out like this and then I use the inside of this hand and I rub it in and my hands don't even like I can just go back
Touch.
to work after it dries. It has a bit of an
Oh,
alcohol. It's
smell. Yeah.
yeah, it has a bit of an alcohol for like a minute.
Oh, that's nothing.
Yeah.
Yeah, and that was funny because my conversation with my vet, of all things, when I had my dog there, she says, "Oh, if you're gonna go to estrogen route and the gel," she says, "you better make sure you wash your hands really good and not touch your dog because I've had dogs come in growing nipples." I'm like, really? Because people don't wash their hands after putting on gel? I don't know.
Okay. I'm gonna call that a big fat lie because you would have to apply estrogen to your hands and then touch your dog every day for, I don't know, a year, 5 years. I don't
Oh
know.
my God.
Like,
But
yeah.
yeah, I was like, oh my God, now I got to wash my hands really well. I mean, not that I don't anyway, because it's flu and cold and flu season, but it's like just something else to be
I
paranoid
don't,
about.
yeah, I just don't. People come to me with some of these crazy things about, will it harm my husband? And I'm like, literally, you would have to like rub up against your husband. And I don't want you to do that because then you would lose the benefit of the treatment for
Yourself
yourself. So,
makes no sense.
yeah,
Okay. And then, so then for adding progesterone, like we were just talking about,
yes.
how do I start with the lower dose if I'm doing the transdermal estrogen gel?
Oral progesterone, 100 milligrams is the lowest dose.
Okay. Okay. I think I'm set.
Okay, so then next week you'll have a big update for us.
Yeah, major. Woo.
Awesome.
Thank you.
Awesome. And I'm just going to quickly circle back to Deborah because in our conversation we didn't mention pelvic floor physiotherapy. So just wanted to also put a plug in for that with you as well.
I've had that.
Okay, cool.
But and then I actually took it a step further and I got the other treatment, the throne treatment,
Oh,
the
yes.
Euro spot.
Hmm. And
Yeah, loved it. Loved it.
really,
It's expensive though,
yeah.
but I loved it and it worked for me. And I had several treatments and I haven't had to go back. And it really, I had incontinence before my surgery in a very
Okay.
bad way. Then after the surgery, I was worried it was going to get worse. And the Euro spot treatment for me was a great cure. However, I had to ask for something that it's going to sound really funny. I had to ask for the sex treatment.
Oh,
And
really?
so you know what that is?
Well, no,
They,
I mean, I don't even really know their product offering that well. I've seen them at a couple of shows, but it doesn't come up that
right.
often.
Okay, I'll tell you what the sex treatment is, and then I'll go back to what it is. So the
Okay.
sex treatment is the strongest level that they have. So they have four levels. And when you go in and you pay your money, you usually only get one and two level, and then you go back for your um, maintenance and you get the third level. But for me, it wasn't working that well. And I said, I don't know how many people you have that have had hysterectomies or that are maybe in their 50s but like there's something that's not quite working, I think. So they said, well, we'll give you the sex level, level four, which is the strongest they have, which women come in at all ages because they want their vaginas to be tighter because of all the reasons that we've talked about. Women want their vaginas to be tighter and they call it a sex thing. So, needless to say, it didn't feel a whole lot different. For me, it felt like it was working. And then it worked and it enhanced sexual pleasure and also dealt with my incontinence. So
Okay.
that was a great
Okay.
thing. So the Euro spot I went to because I felt like the physiotherapy for me was taking too long.
Mm.
Like you really have to go for a couple of years,
Oh, you have to do
in
the
my
exercises
experience,
when you're not there.
and do exercises your whole life. And I just really wanted to jumpstart it uh, after
You
my
have
surgery.
a customized exercise program now, though, that you can do on your own.
Yeah, yeah.
Good. Awesome.
But for me, it jump started it. It cost $2,500.
Wow.
And the maintenance sessions are $300 or $350 each, and you do like 5 or 6 of them.
Wow.
But I didn't have, and so then I did another round of the maintenance, like, and then that was like sort of like 300 every, say, 3, 4 months. I did that for about a year, year and a half. And then I found that my incontinence really improved.
Well,
So
thank
I
you for
was,
sharing your story because they're popping up everywhere. I noticed they're opening up a new location here in Vancouver
yeah,
soon, and they were at the Menopause Show last year.
yeah.
My information comes from the pelvic health physio world, who have taught me, that we can't outsource our pelvic floor exercises, and so I often will say that.
Mhm.
But I'm also, as you know, like I'm a huge advocate of like doing what works for you, right? So you
Well, I
did.
think
And
that,
I'm glad
yeah,
that I have your story as well to help frame it.
they say it's something like I don't know, 10 million Kegels per session or something like that. Like I forget what the number is exactly, but you
Yeah.
just go and you sit there in your track pants or your jeans or your shorts, and that's it. You just like read your phone for 20 minutes and you're done. Like it's really simple. And yeah, for me, I think it's worthwhile, and I think I'll keep going back for maintenance every year, and I'll do the pelvic floor exercises in between that. Yeah.
Cool. Um, just so everyone who's listening knows this, because because we were talking about interpretation, not everyone needs Kegels. And not everyone is loose and needs to be tighter. I think those are two big misconceptions about pelvic floor health. So Kegels are appropriate in for some individuals, but it's really important to get assessed by a pelvic floor expert so that you're doing the exercises that are designed for you. And on the tightness part, so many women, I forget the percentage. I forget if it's over half. We hold so much energy in our pelvic floor that often what we need to do is to learn how to relax it. So it's kind of can often be a misconception that, oh, you got to just like tighten things up down there, and that's not always healthy. Yes, I can, Josie. It's called, what is it called? Eurospot, like this.
And by the way, I use the word Kegels, but they actually promote it as pelvic floor health.
Yes.
But I think that Kegel comes in because so many people do know what that means and they don't really understand the
Kegel
other
is
part.
one form of
Yeah,
pelvic floor health, just like a
yeah,
bicep curl is one form of an arm exercise. Yeah.
exactly. Yeah. So it's more than just that. So, so I don't know. I thought it was interesting to try it. So
Cool.
for me, it was like about incontinence that I couldn't live with.
Yeah, for sure.
So, like it was, I went there with that in mind, not the tightening part. That was a byproduct that came out of the treatment I
And I
found.
think you'll probably find that vaginal estrogen or DHEA is helpful in preventing that going forward too. So cool. Patty's here. I can't see you. I don't know if you want to turn your microphone on, but if you had a question today, um, or an update or a comment. Can you get your microphone on? I'll see if I can do it for you. Or you can type in the chat if you want to. Not working? Okay. Patty, just pop something into the chat if you wanted to give us an update or you had a question. Oh, now she, okay. Got another one joining. My connection is terrible tonight. My screen keeps freezing, so I'm just listening for now. That's okay, Josie. I'm just glad that you're here. Does that work, Patty?
Hi.
Hi, how are you?
I'm fine, thanks. I just read my email and saw that there was a talk on, and I knew I was like jumping in.
Yeah.
So I don't necessarily have a question. I'm just always on the like to get more information. So
Okay. Is there a topic that you want me to do a little mini TED talk on as we wrap this up today?
oh, off the top of my head, I can't think. No,
No
no, I
worries. How old are you?
69.
69. Okay. And do you feel that you have everything that you need right now to enjoy quality of life? Or are you in the middle of making health decisions?
Making some health decisions, yes. I've got your product that I'm
Okay.
quite satisfied with,
Okay.
and 6 months into Premarin
Okay.
for dryness.
Okay.
Jury's still out on that one.
On
I,
Premarin,
yeah,
so there's lots of products that you can choose up besides Premarin if you like. That's a brand name for a conjugated estrogen.
right.
So there we were, I don't know if you were on the call, but we were talking with Gail about Imvexi or Vagifem would be the bioidentical versions of estrogen that you could use.
Oh, okay.
The reason why Premarin is often prescribed as a vaginal option is that it's a cream, and doctors and patients will often choose that because they want the cream, which is fine.
And
As
how
long
is
as you
the
know
other
what's in it.
product delivered then?
So Imvexi and Vagifem are both inserts. They're like little suppositories that
Gotcha.
they're encased like a capsule, and you insert it and then it melts upon body heat. So all the cells of the vagina receive the treatment that way.
Okay. My doctor just said that he wanted me to give it a try for 6 months. So I'm kind of just on that cusp.
No,
So,
okay. But if it's not working for you, it's okay for you to say, no, I'm not going to wait 6 months. I'm gonna change my mind at 4 months or whatever.
yeah, I do have an appointment,
Oh, do
so
you?
we'll be
Okay.
revisiting that. And yeah, thank you for
Um,
directing at me.
my sister is 69. She turns 70 this year. So, yeah, I love it. Got big plans.
Okay, yeah.
Let me know how I can best support you if you want scripts for like script tips for going to your next appointment. I can help with that
Okay.
as
I
well.
was I was curious about that when
Sure.
it came up at your the Zoom.
Yeah, do
And
you want
so
me to speak to script tips right now?
if you've got time.
Yeah, sure. We've got a few minutes. And Gail, you've probably heard this before. Josie's heard it many times, I'm sure. So script tips were born in the Menopause Chicks community as a method for changing the way we show up for our health appointments. And that project or experiment, if you will, was born from a research study that was done here in British Columbia in 2018 or 19 called the In Her Words study. And the In Her Words study really shone a glaring light on the fact that the majority of women, and especially the majority of women aged 45 to 54, I think was their demographic, leave health appointments feeling dismissed or disappointed. And I'm sure that those of you on this call are like, well, yeah, that makes sense because I know in my social circle, um, friends, girlfriends are always telling me, my doctor said this and it wasn't really what I wanted, or I thought I was going in like all like gung ho and I kind of left deflated. You can probably relate to stories like that. The other thing about that statistic that's really, I think, imperative for us to know and to understand is that the number of 54% was increasingly higher for Indigenous women and for women of color who already receive dismissal in the healthcare system at large. And the top two reasons for the health appointments of the people that they were surveying, the top two reasons for them going to the doctor in the first place was menstruation and menopause. And so this is now like 6 or 7 years ago. Maybe, how's my math? 6, 7, 8, probably 8 years ago that this study came out. And menopause still wasn't sort of a mainstream topic like I would say that it has evolved into these last few years. And still, we had like this light being shone on the fact that we weren't being served by primary care very well, especially when it came to menopause. And that is like true. And whenever we receive research, the question should always be, well, what are we going to do about it? Right. So that day when the results came out, I was sitting in the press conference and I was like, I could see and hear people talking, oh, well, we need more education and we need more doctors and we just need to educate more doctors and we just need to change the curriculum at medical school and that'll fix everything. And I'm like, no, it won't. That's ridiculous. I won't be alive long enough to see all the curriculums changed at medical school and to see sort of this turnover of information being transferred to patients in the way that they want it to be. So anyway, it kind of floated for a while and then I was like, wait a second. I have no influence over medical school curriculum, but I do have this amazing community of women who are like leaning into information and education and preparing for their health appointments the way that we've never prepared, like our generation has never prepared for health appointments before. So, what if we showed up in a different way? If we're lucky enough to have a doctor or a nurse practitioner or a prescriber in our health team, what if we showed up in a different way and worked with them, kind of using the script tips a little bit like Deborah and I were chatting about at the top of this hour, and that is they have a couple of things in their toolkit. So if we understand what our prescriber has, they've got a medical degree, they've got a prescription pad, and they've got the ability to refer us on to another specialist if that's necessary. And they can also order lab work and tests and so on. But what if we showed up in the conversation differently? So I surveyed menopause chicks and just like asked them to describe how they were preparing for their health appointments right now. And most of them said, I just go into my doctor, I list out my symptoms, and then I sit back, zip my lips, and I wait for my doctor to tell me what to do. I was like, okay, so what we're not doing when we do that, it's fine to list your symptoms, but what we're not doing is we're not articulating the impact to our quality of life. And therefore, there's a lot of judgment being made, not in a bad way, but physicians are then judging on, oh, you say you don't sleep. Like if I go in and say, hi, doctor. Oh no, I'm good. No, well, my kids. Oh yeah, no, they're great. They're growing up so fast, and then like 7 minutes of the 10-minute appointment are like eaten up just like that. And then the doctor finally says, well, Shirley, like, why are you here today? And I'm like, oh, well, like I made this appointment 3 weeks ago, and 3 weeks ago I really, I'm just not sleeping the way I used to. And then now it's like 9 minutes of the 10-minute appointment is gone, and your doctor's like, well, nobody sleeps the way they used to. Like no one's sleeping, right? And they're inserting, like when I was a resident in the ER, I stayed up for 4 days in a row without sleep. So like, and it's like you can get these judgments introduced into the conversation. So we took all of that from from what women told us and said, how can we change the structure of the conversation? Can we go into our health appointments and say, and save all the niceties to the end of the appointment? You can talk about your kids with your doctor if you want to. You can talk about their kids if you want to, but leave that till the end of the appointment. Go in as if this is your time and you own it. So it's GAP, goal of the appointment, age, and date of last period is the first acronym. So I would say, my goal today is to talk to you about the benefits of progesterone. As you know, I'm 61 years old and my last period was X, or my surgery was, 6 years ago. And then the other half of the acronym is SPEAK. So SPEAK. S is symptoms. So you might say, my symptoms are, my mood continues to fluctuate, or I'm not sleeping, or, whatever the top 2 to 3 symptoms are. P, the second P, is for impact. As soon as we say symptoms, we want to describe the impact to us, because no one can argue with that. And so then you say, the impact this is having is that it's actually affecting my relationships. My relationship with my partner's not the same as it used to be, or it's impacting, the way I interact with people at work, or I seem to be flying off the top of my head with my kids, whatever it is. That impact is yours and you own it. And now your physician goes, oh, I see that there's a problem. Remember, they are scientists and they love to solve problems. And this is the impact that it's having on this person. Doesn't matter what the last person in my office experienced, because that's their health story. This is what Patty is experiencing, or Shirley is experiencing. And then very quickly, we go into EAK. So E is education. And that's the part, Deborah, where I was saying earlier, it's okay to say, oh, you know what? I've been investing in my own menopause education lately, and I learned that progesterone is responsible for more than taking care of the uterus. It also supports mood and sleep. Affirmation is the A, and I love this part. You don't have to use it if you don't want to, but this is a chance in the conversation where you've said the problem, you've described the impact, and then you get to say, you know what? I know that I deserve to feel amazing. Or I know that I deserve to sleep through the night. Or I know that I am not supposed to have vulvar and vaginal pain. I know that I am not meant to pee my pants. Anything that's just like a real ownership statement. And then K is an invitation. It's the key next steps. It's like, okay, so now that you've heard my story and you understand how it's impacting my quality of life, what are the key next steps that I can take to prioritize my health? And it's a little bit of a language shift, that if there is a power dynamic between a physician and a patient, which there often is, it brings the conversation into teamwork. You're both on the same team, and now you're like looking to go forward and solve for the next best step. And I probably just like made that way more complicated than what you might need if you're going to your doctor to ask for vaginal estrogen, because I can tell you that those conversations are becoming much more common, not in every situation, unfortunately, but in a lot of situations, it's possible that you could just show up for your appointment and say, I'd like a prescription for vaginal estrogen, and you could be on your way. But in some cases, it's a little bit more than that. It's, I've been living with insomnia for years, or I had a hysterectomy and I'd like to take progesterone, and you're kind of maybe working against some conversations that you've had in the past with this healthcare provider. So obviously you can take a set of acronyms that we developed, but the ultimate goal is that they give you ideas and that they give you confidence, and then you tweak it so that it works for your personality and works for your particular health situation. How'd
Thank you. That was good.
how'd I do? Does anybody want to try some script tips right now? You got it? All right. All right. Well, it's 5 o'clock. I pretty sure that we're on for next Monday. Let me just check the date. It's every Monday unless I'm traveling. So next Monday is February 9th. I know some of you have health appointments coming up this week, so I'd love an update. And if you need anything between now and then, send me an email, shirley@menopausechicks.com.
Can you email the replay, Shirley? Because of my it was so choppy, I missed some of the information. I'd like to re-watch it if
Yeah, I
it's
can send it to you, Josie. Yep,
thank you.
you're
Thank
welcome.
you. Okay.
Thanks. Thanks, Deborah. Have a good night, everybody.